Genetic testing by Peyton Wallace. Genetic testing can be defined as a type of medical test that identifies changes in chromosomes, genes, and proteins. These results may confirm or rule out a suspected genetic condition. It can help determine a person's chance of developing or passing on a genetic disorder. This process is completely voluntary. There are multiple people involved with genetic testing. These people include primary care doctors, primary care specialists, nurse practitioners, and even pathologists. They are able to perform the genetic test. Laboratory workers are also involved and able to report test results in writing to a person's doctor, genetic counselor, or the patient themselves. Genetic counseling centers are also involved within these procedures. These centers are conducted by doctors who have specialized in human genetics or who have other qualifications in this area. They provide emotional and physical support for individuals experiencing this process. Next, we have methods of genetic testing. One method is molecular, aka the gene test. This studies single genes or short lengths of DNA to identify variations or mutations that cause a genetic disorder. Another method is chromosomal. This analyzes whole chromosomes or long lengths of DNA to see if there are large genetic changes. An example of this is the extra copy of a chromosome. The final method of genetic testing is biochemical. This is the study of the amount or activity level of proteins. Abnormalities in either can indicate changes to the DNA. How this test is performed is very simple. The genetic tests are performed on a sample of blood, skin, amniotic fluid, or other tissue. The sample is then sent to a laboratory, and technicians begin to look for changes in chromosomes, DNA, and proteins. Genetic testing can be done for a number of reasons, including diagnostic testing, which if you have symptoms of a disease, genetic testing can reveal if you have the suspected disorder. There is also pre-symptomatic and predictive testing. Before symptoms, this test can show if one is at risk of developing a gene condition within family history. Genetic testing can also be used as a way of carrier testing. This can detect genes associated with a variety of genetic diseases and can identify if one is a carrier of the same conditions. There is also pharmacogenetics. This can determine what medication and dosage will be most beneficial based on a particular health condition an individual has. Genetic testing can also be used to perform prenatal testing. If pregnant, these tests can detect some types of abnormalities in babies' genes. This test can also do newborn screening. This is the most common type of genetic testing, required by all states. This tests newborns for certain genetic and metabolic abnormalities that cause certain conditions. Lastly, genetic testing can be done to perform pre-implantation testing. This is also known as pre-implantation genetic diagnosis. This is used when attempting to conceive a child through in vitro fertilization, or IVF. This screens embryos for genetic abnormalities. There are numerous ways that genetic testing can benefit individuals. It can provide a sense of relief from uncertainty. Test results help people make informed decisions about healthcare. It can help with decisions regarding pregnancy. And genetic disorders can be detected early, an example of this being newborns. With a number of benefits comes risk and limitations. These include emotional, social, and financial consequences, and genetic testing can create tension within family, because results can reveal information about other family members that they might not know. There is also a possibility of genetic discrimination. This occurs when people are treated differently by their employer because they have a gene mutation that causes or increases the risk of an inherited disorder. Other risks and limitations of genetic testing is that this procedure only provides limited information on an inherited condition. It does not determine if a person will show symptoms of a disorder, the severity of symptoms, or progression of the disorder over time. There is also a lack of treatment strategies once genetic disorders are diagnosed. However, everything is dependent on a particular test. If a genetic test reveals a positive result, this means a change in a gene was detected. This may also confirm a diagnosis and indicate if a person is a carrier of a genetic mutation. This can also detect increased risk of developing a disease and may suggest the need for further testing. However, if a genetic test reveals a negative result, this means no change in a gene was detected. No one was affected by a particular disorder, and there is not a carrier of a gene mutation. There is also no increased risk of disease development, and further testing may also be required. The cost of this procedure is heavily dependent on the nature and complexity of the test. It can range from around $100 to more than $2,000. The cost increases when multiple family members must be tested, or more than one test is necessary. Newborn screening specifically varies from $15 to $60 per infant. The costs vary per state.